Imagine that someone needs a life-saving blood transfusion, but a doctor refuses to provide that service because of a personal moral belief. What would your reaction be? Probably that the doctor can't do that. The patient needs immediate medical attention, and she should be taken care of right away. But it is legal, as of right now, for doctors to refuse to provide other services, like abortion and physician-assisted suicide. When a physician refuses to provide some service based on a strongly held moral or religious belief, it is referred to as conscientious objection. The question then is, should they be allowed to do that? Philosophers Shuklink and Smalling argue no. Conscientious objection in the medical profession is not professionally permissible. In this video, I'll cover two of their arguments for this claim. The first argument, what I'll call the legal and standard argument, is based on the simple claim that doctors have a clear professional duty to take care of their patients' needs. If a service is legal, standard, and in the patient's interests, then clinicians shouldn't be allowed to refuse to provide that service. For instance, OBGYNs have to provide or assist in performing abortions even if they have a strong moral or religious objection to doing so. What it means for a service to be legal is straightforward. But what do they mean by standard services? One possible way to understand which services are standard is to look at the definition of standard care provided by the courts. In the court case Hall v. Hilburn, 1985, we begin to see the development of how we understand standard medical care as that which a minimally competent physician in the same field would do under similar circumstances. So I'll assume that Shuklink and Smalling are using the term standard care in this sense, although there may be other ways of understanding their view. Of course, a defender of this argument has some more details to fill in. For instance, what counts as in the patient's best interests? What's in the patient's best interests can't just be what they want. People want things that are not good for them all the time. Perhaps a temporarily clinically depressed person wants to die, but it may not be in their best interest to die, even though that's what he wants. So I'll leave this very important question as an open issue and assume that something is in the best interest of the patient when that thing would, on the whole and given their circumstances, make their lives better off. The second argument against conscientious objection is what I'll call the argument from arbitrary refusals. To get a grasp on the basic idea here, consider my early example of a doctor that refuses to provide a blood transfusion based on moral or religious beliefs. It seems to most of us, I suspect, that doctors shouldn't be allowed to refuse to provide blood transfusions. But if doctors shouldn't be allowed to refuse to provide that service, what reason do we have to think that it's professionally permissible for them to refuse to provide other services like abortion or physician-assisted suicide? Shuklink and Smalling argue that there is no reason. If doctors can refuse to provide one service, then we've opened Pandora's box. They can refuse to provide any service they don't want to provide. But, of course, that's absurd. Doctors can't refuse to provide any service that is typically expected of them. As a result, conscientious objection isn't professionally permissible because if it were, then doctors could, for seemingly any reason, opt out of providing services that are typically expected of them. As I say, there are more details to fill in here, but I think you get the big picture. Doctors shouldn't be allowed to refuse to provide legal and standard services that are in the patient's interests, and there's no principled reason to say that doctors can refuse to provide one service, but not others. Thanks for watching 5 Minute Ethics. Please like and subscribe.